Okay, you guys, here is the case study for meningitis. We've got a mother bringing in her 6-month-old child to the ED. 4 days ago, the infant was diagnosed with otitis media. Now the mother says her infant is lethargic and cries constantly when held. The infant has not eaten in 8 hours and only ate 2 ounces with the last feeding. Again, don't forget, with meningitis, we see an abrupt onset, typically following otitis media or an upper respiratory infection. We see in our assessment data that the infant is lethargic and crying. That cry would be that high-pitched cry. Signs and symptoms, I kind of already went over all that. Okay, let's go through the questions here in the case study. What intervention should the ED nurse anticipate after assessing the child? My answers for this one are antibiotics. We would culture before meds start. We give large doses, 10 to 14 days, but they come in and we do the culture. We look at the cerebral spinal fluid, and then we, as soon as we get the cultures, we start the antibiotics. We don't wait for culture results because it could take a while for those to come in. If we get the results back and we need to change the antibiotics, we'll go ahead and do that. They would be in respiratory isolation, a quiet room, decreased environmental stimuli. We would make sure that we are encouraging fluids. We would start an IV, seizure precautions, anticonvulsant. We would want to make sure that we're placing this patient near the nurse's station. We would want to restrict visitors, and we would want to keep the head slightly elevated to decrease any ICP. When performing the initial assessment, the nurse found that the infant's head was flexed, his knees and hips are flexed also. This would be a sign of it would be C, Brzezinski's sign. Our next question is, Okay, now we got a 3-year-old child with meningitis. They're documented as having photophobia. Which of the following interventions is most effective in minimizing this symptom? Provide rationale. All right, obviously, I'm assuming you guys all know that photophobia is a sensitivity to light. So A, avoid using the TV. Patient will avert their eyes from direct light, discomfort to the eyes due to light exposure. And again, this is going on because meningitis is a central nervous system irritant. Which of the following vaccines protect infants from bacterial meningitis? Select all that apply. Provide rationale. I'll let you guys take a look at those for a minute. All right, my answers were B and D. So pneumococcal vaccine, inhib, H influenza type B vaccine. H influenza is the leading cause of meningitis, so we do see the most dramatic change in our patients getting this. All right, let me read my other notes here. I think we've kind of already talked about these things. I told you the signs and symptoms already. We talked about diagnosing with a lumbar puncture, increased protein. We talked about culturing for H influenza, E. coli, strep, ICP, increased intracranial pressure. Early signs and symptoms are subtle. Late, we see that widening pulse pressure, increased blood pressure, bradycardia. We see personality changes, irritability, fatigue, increasing blood pressure, decreasing respiratory rate. Again, that ICP chart, we've talked about that a couple of times. Standard precautions, respiratory or droplet precautions for 24 hours after antibiotics. Some of the nursing diagnoses that are on your other set of sheets would be risk for infection, the communicability of meningitis, so you'd want to check the family, and perhaps we would prophylactically treat them with rifampin. Risk for injury, you should be thinking of seizures because again, it is a CNS irritant. Decreased nutrition, NPO or clears initially may be unable to suck. Remember, we said that this baby coming in was pretty lethargic. And again, anytime we are worried about nutrition, we are always monitoring their weight and their input and outtake. All right, I'm going to try and flip my screen over here to Down syndrome, so bear with me. Okay, no, that's seizures. Feel here well, yeah, that's our meningitis, that's seizures. Okay, here's Down. All right, Down syndrome. I'm talking about Down syndrome because it is the most frequent chromosomal abnormality. They have 47 instead of the normal 46 chromosomes. We will see varying degrees of intellectual deficits. We could see congenital heart disease. It's common with Downs, hypotonicity of the chest and abdominal muscles, immune and thyroid dysfunction. They do have a higher risk of leukemia. Trisomy 21 is the most common. We see Down syndrome equally occurring in males and females. Cardiac and GI become their biggest areas of complications. Make sure that their eyes and thyroid, we're doing annual checkups. When it comes to Down syndrome, what we could see on assessment, I don't know why this is so touchy, but it is, sorry. All right, what we could see, slanted eyes, epicanthal fold or an extra fold, large protruding tongue, their nose is broad and flat, poor muscle tone, low set ears, simian crease. The IQ range is lower, early developmental stimulation and intervention to maximize potential, encourage self-care skills, optimize socialization skills, and lifespan, they typically live into their 40s and 50s. Again, don't forget when we're taking care of somebody with Downs, age is developmental, not chronological.